Hello. Today we're going to be demonstrating the proper administration of range of motion exercises. As a nurse, you will frequently assess your clients for their range of motion and create an individualized plan to help them maintain their range. Whoever coined the phrase "use it or lose it" may as well have been referring to range of motion, because contractures may develop in joints that are not used, which can lead to debilitating and unsafe conditions for a bedridden patient. Keep in mind that range of motion may be conducted actively, where the patient performs the exercises unassisted; passively, where the nurse moves each joint through its range of motion, or somewhere in between. Generally, you want the exercises to be performed as actively as the client's health and mobility allow. When working with your client, remember to select a suitable location that allows your client to safely perform their exercises while lying, sitting, or standing. Take into consideration the client's modesty. For instance, if they're wearing a gown, or if in an outpatient setting wearing a sweatsuit. Close the door or use a screen if the client needs the privacy, and don't forget your HIPAA regulations. In the following vignettes, the nurse will have already washed their hands, assessed their client for mobility, and are at a point where they are ready to implement the range of motion exercises in their nursing plan. But first, the exercises.
When you enter your patient's room, introduce yourself and make sure you are with the correct patient by looking at their name band and asking them their name. Also, tell your patient the purpose of your visit and what you will be doing. Begin by flexion and extension of the neck. Bring the chin to rest on the chest and then return the head to erect position. Continue with rotation of the neck. Turn the head as far as possible in a circular movement. Lateral flexion is tilting the head as far as possible towards each shoulder.
Extension of the arm.
The shoulder is a ball and socket joint. Begin by flexion and extension of the shoulder.
Abduction.
Continue with abduction and adduction of the shoulders.
Now circumduction.
Similar to the head, we will circumduct the shoulders by moving the arm in a full circle.
Flexion, extension of the elbow. Flex. We're going to extend.
The elbow is a hinge joint. Flex and extend the elbow.
Internal and external rotation.
Continue with the elbow flexed. Rotate the shoulder by moving arm until the thumb is turned inward and towards the back. Supinate and pronate the forearm.
We're going to flex and extend and hyperextend. Again, flex, extend.
Continue with flexion, extension, and hyperextension of the wrist.
And then now we're going to move to the right side.
Adduct and abduct the wrist.
We're going to circumduct the wrist.
Now circumduct the wrist.
Okay, other way. Ask you to clasp
Flex, extend, and hyperextend the fingers by making a fist, straightening the fingers, and bending the fingers back as far as possible.
fingers is next. So open up your fingers, very good.
Abduct and adduct the wrist by spreading the fingers apart and bringing them back together.
You can circle further. You can flex it and extend it. So
and extend the thumb. You can also abduct and adduct the thumb by extending it laterally and moving it back towards the hand. The last movement of the thumb is known as opposition, touching the thumb to each finger of the same hand.
Flexion, extension, and hyperextension.
The hip is a ball and socket joint. You can flex, extend, and hyperextend the hip.
One more time. Flexion, extension, hyperextension. Now with the hips, I'm going to hold at your different joints. Me holding your knee and your ankle. And we're going to abduct the foot and adduct it. So move away is abduction and moving towards, back towards and
With the hip, you can abduct and adduct. By doing that, you will move the leg laterally away from the body and bring it back to its normal position.
your feet internally.
Perform internal and external rotation of the hip.
External rotation. Internal and external.
Circumduct the hip.
Okay. With the knee, we're going to flex and extend. So flexion, and then go back to the normal position, extension.
Flex and extend the knee.
Extension, flexion, and extend. Ankle, we're going to do what's called plantar flexion and dorsiflexion. So let's do plantar flexion, point, and then backwards is dorsi. Again, plantar flexion, dorsiflexion. Try to go as far back as the patient can tolerate. Now we're going to circumduct. Very good. Other way. Inversion and eversion. So that's inversion, this is eversion. Inversion, eversion. Okay, so with the toes, we're going to flex this way, pointing outwards, extend and hyperextend. Again, flex, extend, and hyperextend, flex, extend, and hyperextend. We can also do abduction and adduction, just like the fingers. So for abduction, we're going to pull the toes as far apart as possible. Adduction, bring them back in together. Again, abduction, pull them as far apart as possible. Adduction, bring them in together. Last time. Very good.
When you complete the passive range of motion exercises, make sure you evaluate your patient for any pain and for comfort level. You must also document your actions and findings in the facility's preferred format.
In the video, we demonstrated range of motion on only one side of the body. But remember, you will exercise both sides of the body. The mini clips show the nurse doing active range of motion techniques, while in the larger clip, you notice the nurse aiding the client in passive range of motion. Range of motion is designed to exercise the joints and muscles of the body. It is important not to forget to go through the head, neck, shoulders, arms, wrists, hands, fingers, hips, knees, ankles, and toes. You have seen the proper administration of range of motion exercises. Remember, all joints need to be moved through their range of motion to avoid the negative effects of immobility. Chart your actions and evaluations using your facility's approved format, whether SOAPy, PI, DAR, or other formats. When it comes to range of motion, remember, use it or lose it.